since coronavirus became such a big part of our lives. I mean, it sucks up all the oxygen in the room, doesn't it? We've learned a whole lot about it, but this is a virus scientists will be studying for years. So we probably don't know as much about it as we think we do. Even though the vaccines are reason to be hopeful, a lot of us are still looking for simple answers about the best ways we can stay safe amid these surges. Dr. Kian Vu joins us. You know his face. He's an assistant clinical professor of health science at UCLA Olive View Medical Center. He's also a performance and longevity expert. And Dr. Vu, you're a friend of the show. We appreciate you lending your medical expertise to us today. Are you ready to go? I'm going to do rapid fire questions.
Rapid fire, let's go.
Well, maybe not so rapid because I'm not so rapid today. How often should I wash my mask?
It's very important to wash your mask after every use. I want people to know that you could either wash it by hand or machine wash it. Don't be afraid to throw it in the laundry machine with the rest of your clothes. Wash it with regular detergent and also in the warmest setting the material can handle.
Somebody told me that you should treat it like your underwear. Wash it as much as you wash your undies. Will I be more protected if I wear two masks? Maybe even a cloth one with a surgical one?
Well, in theory, you might be more protective. It's all about the barrier. The better the barrier, the better the protection. However, if you have two masks on, it's possible that you might fiddle with the mask a lot more often. You might touch other things and be more tempted to touch your face. That's not good. Also, two additional layers can make it harder to breathe. So I recommend people just wear one mask that's multi-layered.
Right, and just leave it alone. Don't be fidgeting with it all day, right? We all do that. I mean, I make that move all the time, the nose move. Okay, let's talk about the whole issue of if you come in contact with somebody, which seems more and more, it feels like it's closing in on us, right? More and more of us in our circle of people that are contracting the virus. If I was around someone who contracted COVID, how long should I quarantine for?
Okay, so the LA County of Public Health recommends that if you've come in contact with somebody who's infected, if you're coming into LA County, or if you've been in a gallery where people weren't social distancing or wearing masks, you quarantine yourself for 10 days.
Okay, and that means stay at home, stay isolated, correct?
Yes, that means stay at home, yes.
Right, because we just have to like really make that, because people think, well, I'm just slowing my roll a little bit. No, shut yourself in, honey. Okay, now what about if someone in your home, your spouse, your kiddos, somebody contracts the virus, how can I best protect myself while I'm also trying to care for them?
Very good question, Michaela. This is the only time or only excuse you should have for distancing from your immediate family. But it's important. People should be quarantining themselves in their own rooms. Limit the amount of time you are in the communal areas, such as the bathrooms, the living rooms, and things like that. And remember, physical distancing is not social distancing, so you can still use FaceTime on your phones to communicate with your family members.
And I suppose if you have a house that has multiple floors or it has a second bathroom, dedicate that bathroom for the person that's ill and everybody else stay in the other part of the house.
Yeah, that's a great idea.
Okay. Here's one I really need to break down with you, because we have seen anecdotally, we've seen a few people talking about the fact that wearing a mask is dangerous to our health. We've had sound bites from anti-mask people, protesters, that are saying that they believe that it dangerously depletes our intake of oxygen. Doc, go ahead and dispel this myth.
Masks are super important. Everybody should be wearing their mask. So in general, masks are super safe for everybody. Now, there are some minor things that masks can cause. For example, there is something called maskne. That's a big breakout in your lower lips, in your face area, and that's caused by masks that are not clean, if you've got an allergic reaction to the material, or if things are like bacteria or fungi are growing in your mask. So it's really important, have a clean mask. If you're reacting to it, maybe try a different material. Now, there are very small studies that demonstrate that people that have underlying lung conditions, if they're wearing just the N95 mask, they can build up carbon dioxide levels in their bodies. So if you've got an underlying lung condition, you should talk to your doctor about which mask to wear. But by and all, they are super safe and they're protecting against the spread of the virus.
And by the way, doctor, if you have an underlying lung condition, you should probably staying at home and not going out into public, because you are at a higher risk of contracting coronavirus and getting very ill from it, are you not?
Yes, if you have any underlying condition, if you are somebody at risk, elderly, or if you've got a chronic disease, it's best for you to stay indoors and stay at home.
Can we do a revisit on this conversation of you answering questions for us, maybe when the rollout of the vaccine comes around? Because I know people are going to have lots of questions about the vaccine. We're in like phase 1A of it. When it gets rolled out a little bit more, we can do that. Sound good?
Always happy to chat with you, Michaela.
Oh, I love chatting with you, Dr. Vu. You take care. Thank you for your hard work. Stay safe.
Thank you.
Okay. For more information, you can check out Dr. Vu by checking out his book. It's called Thrive State, or his website, kenvu.com. Still to come right here on